Now, since 1905, it's been known that the women's breathing is different to men's. And like many things, breathing for women is much more tailored than it is going to be for men because of the hormone cycle through the month. In particular, we're looking at stages from 1 to 22 days into the cycle, so the mid-luteal phase to the mid-follicular phase. In these parts of the cycle, breathing is going to become very different and slightly more erratic, so slightly quicker than they would be at any other time. This adjustment in breathing also adjusts things like PMS symptoms, as well as your things like pain threshold, and other things coming up. So it's very, very important that women are tracking their breathing alongside their cycle. But the interesting thing about breathing is that you can directly affect your breathing. So if you are doing breath work that directly affects your breathing and is encouraging you to breathe lighter, slower, and deeper, through these exercises you can actually affect the amount of PMS experienced overall through your cycle. It helps you negate some of these quickenings and dysfunctional breathing leanings as you go through the luteal and follicular phase of your menstrual cycle. The menstrual cycle is a superpower that women have, and by tracking it, you can really optimize your health to levels which are just so good for you. The way to do this is to measure your BOLT score, so your body oxygen level test. Is a great way to measure functional breathing and when it becomes less functional, as well as when it is functional. So by tracking your BOLT score every day, writing that score down in the notes on your phone or wherever you can actually see how your breathing is changing over your cycle, and there where breathwork practices would be best placed in your cycle to achieve best optimal health results for you as an individual. So tailoring it for you specifically. Very, very interesting and something to maybe check out and look into. See you on the next one.